Welcome to the Brain Health Hookup. I'm Laurel Myers Hurst, your resident groovologist, and I believe that better mental health needs to be fun. Here we talk about mental wellness, we explore the physical, emotional, and relational needs we have as humans with the science and practices that help our mental health to flourish. Plus, we dive into my signature method, groove therapy, that engages folks in groove-based music making to lift mood and lower inflammation and pain. I'm so glad you're here. So let's hit it. Well. That's a deep subject. On today's podcast, we'll be talking about one of the major sticking points I have with diagnosis and the Diagnostic and Statistical Manual of Mental Disorders. If you're curious about this as a clinician or as a patient, we have so much to talk about. We'll end up also today talking about what integrative care can offer in this realm that other kinds of care cannot. So thanks for coming along for the ride. If you're not familiar with the DSM, it's now in the 5th version with a little bit of a addendum on it too, the DSM-5-TR. It's the Diagnostic and Statistic Manuals of Mental Disorders. These are the lists that clinicians use, either therapists or psychiatric medical care providers, to determine what disorder you qualify for. These are not lists of what is wrong with you. These are actually lists of symptoms grouped together. And as we intervene or make changes, as we put in place things that we hope will help promote healing, we're going to compare the list of symptoms that you had at the beginning of the treatment and then into the treatment. We're going to recheck that list to see what sorts of symptoms remain. In very few cases are these what is actually wrong with you, though, and that's my whole problem with the Diagnostic and Statistical Manual. At the end of every single list that qualifies for someone for a disorder, whether it's depression or anxiety or PTSD, after the list of symptoms that are usually found with that diagnosis, there is one qualifying statement. That is, do not include symptoms that are clearly attributable to another medical condition. Now, if you're a clinician, you can tell me what you do. As a patient, I largely hear that there's not any alternative considered when they're taken through a list of qualifying symptoms for a diagnosis. There's never any talk of what else could be causing the symptoms. It's more of the other way. Like you go into your doctor saying, I have a problem with losing weight. And they say, oh, you have anxiety. You just need to see a psychiatrist. Or, I haven't been able to sleep for 6 weeks and no one's checking hormones or cortisol levels. They're like, oh, you must have anxiety or you must be depressed and you have sleep disturbances. I feel it's more often medical providers telling patients they need to see psychiatric care providers than psychiatric care providers saying, you meet 3 or 5 criteria for this diagnosis of depression, anxiety, PTSD, or whatever, but there's alternative explanations for 3 to 6 of those things. And we need to do the testing, the background check, the cross-checking to make sure those medical reasons, the biological reasons that could be causing your symptoms are not the real factors behind what's going on. So how do we do this? In my practice, which is integrative, meaning we pull all of the possible reasons in to our diagnostic process, and also all as many as we can, the alternatives to how to treat those symptoms. We do all of those. We pull in all of the threads that could be causing and all of the threads that could relieve the symptoms that a patient presents us with. So that's a very integrative approach. It's different than standard of care. Standard of care typically accounts for a certain set of symptoms. In my experience, ignores that rule about finding other medical causes of the symptoms, and then follows treatment guidelines that are published by different organizations about what medications or psychotherapies are most effective for that set of symptoms. So that's standard of care compared to integrative care. What do we look at in integrative care? One, we look at inflammation for sure. We look at measures of inflammation in the blood to see if inflammation could be causing some of the symptom disturbance. So, not only can inflammation be a straight up cause of symptoms, even according to the standard of care guidelines, there are different pathways for medication treatment depending on how high your inflammation is. So, people with higher inflammation tend to do it better with certain medications like SNRIs, medications that support norepinephrine, especially in depression, than in people who don't have high inflammation. They might take a totally different route medication wise. So, when we're working as integrative providers, it's really important we only test the things we also can intervene for. So while I might know that female hormone problems can cause certain symptoms that are described in the DSM, if I'm not also able to handle that information, I definitely need to refer a patient to an obstetric gynecologist who specializes in female hormones. So, when I'm talking about integrative care, every integrative provider has their wheelhouse. They have the certain tests and checks and balances and interventions they can provide. And we are constantly learning. So I would expect that 5 to 6 years from now, I may be very adept in dealing with female hormones for psychiatric symptoms and concerns. Today, I might highly suspect the patient has trouble in that area and refer them on to another provider. But inflammation, this is something easy to check. It's an easy blood test, and we know the interventions that can help. We talk about that in my course. So, another thing that we check is nutrition. Even if someone has their life all together and their stressors are pretty low, they can have anxiety and or depression and fatigue and sleep disturbance just by things like vitamin D being off. And I find my patients all too often get the answer from their provider, their primary care provider, well, your vitamin D is low, but go see psych anyway, rather than saying, let's clear up this vitamin D problem. And if you're still having symptoms, let's go see psych. That would be my preferred course. Instead, I get a ton of patients who have vitamin D in the single digits when I'd love the number to be 50 to 80 on the test results. They're in the single digits, and I know it's not even safe for me to intervene with medication at that point because vitamin D deficiency alone could be causing their symptoms. So in nutrition, we check nutrients, vitamin D, vitamin B, we check iron, and we cross-check some of those things also, magnesium, zinc, phosphates. And we also do a preliminary check on the things that are affected by deficiencies, like thyroid hormone conversion. So we might do reverse T3 exams for someone who has mood symptoms, especially when their nutrients are out of whack because they need those nutrients to convert those hormones. So inflammation, again, can cause symptoms and affect the course of treatment. Nutrition definitely can cause symptoms, and it can make people treatment resistant. So if you're in a situation where you seem to have gotten the proper standard of care, like the proper medicine for your condition and or the proper psychotherapy for your condition, but you're not moving along, you really need help from your own provider or an integrative provider like me to look at the nutritional components that might be forcing your brain not to grow and change as quickly as it could if it was better nourished. maybe the nerves aren't coated as well as they should be in the phospholipid fats that help the brain conduct the electric signal. Maybe your hormone conversion is way off because you don't have the basic fundamental building blocks. Just take one thing, for example, phosphorus. So phosphorus, we know our soil is depleted. We know that a green bean today has about a fifth of the phosphorus in it that it had in 1950. So even if we'd have to eat 5 times the amount of vegetables today to get the phosphorus that we would have gotten in 1950, for instance. But why is that so important? Phosphorus, like I said, is part of the lipid coating on every nerve to help with the speed of connectivity. Phosphorus is integral to every energy packet that's made in every cell's mitochondria, the little power factories in your cells. ATP is the power packet, and phosphorus is P in the ATP. So you cannot have robust energy and the feeling of desire to do the things you would normally enjoy if you have absolutely depleted your phosphorus. And magnesium similarly. See all kinds of problems from magnesium deficiency that affect mental health symptoms. So rule number 1 in the DSM, every single diagnosis is do not include symptoms in this diagnosis that are clearly attributable to other medical conditions. So that's why we're talking about these factors. The last factor that an integrative care provider checks for that other providers might not is the occurrence of injury. This might be physical injury, like traumatic brain injury from bicycle accidents, falls, car accidents, and then developmental injury, ways that your primitive reflexes got arrested in their development or took a back step when you had an infection or an accident or undue stressors or certain movements that brought on primitive reflex dysfunction. So injury to your physical neurological system and injury to that primitive reflex setting, the pattern of primitive reflexes can cause focus and concentration problems, mood dysregulation, irritability, definitely all of those things. And then there's emotional injury. Traumatic stress plays an incredibly important role in the way we feel, think, and act. And I am astounded by patients who come to me after 10 or 20 or even 30 years of care with certain medications, often high risk medications. They have never been asked about how their symptoms started, what the patient themselves attributes the start of the symptoms to, and what they think is going on. So trauma is often followed by mood changes, changes in how we think, feel, and act. That is a normal course of events. Very few times do people experience emotional injury and stress and they go on and they're exactly the same. We need a community of support and targeted interventions to bring us back to ourselves and to grow beyond what we could have been. That's actually the real goal, is to say, before my trauma, I was here and it knocked me down. And I then leapfrogged into a new, even more capable person, capable in my intellectual, emotional, and relational pursuits. That's the goal. So if integrative care sounds like something you're interested in, of course, I do take private clients in Ohio, and we're working on a course that brings all the things you won't find in a regular psychiatric appointment to kind of an encyclopedia of knowledge. That would be a course called The Well-Tuned Woman. If you're interested, let me know. You can message me, The Well-Tuned Woman, and Well-Tuned anywhere, and I can get that information to you. I really appreciate you listening in. This is a very deep conversation. You may have to listen to it a couple times to catch the depth of the knowledge. But the point is, if you've been going to be cared for by a primary care provider or a psychiatrist, and most of what I said today you've never heard of before or no one's ever asked you about before, that you can see how there are many other avenues of care that you might need to pursue to be fully healthy and flourishing the way you'd like to do. And that's what I want for all of us. Take care. Thank you for tuning into this episode of the Brain Health Hookup. I hope this episode radiates with the conviction that generating mental wellness needs to be fun and safe. We want you to find your power and understand your innate design to flourish in everything you do. And we hope that inspires you to come back and listen for more. I'd love for you to leave a review of this podcast, as it helps this show grow to reach more people who need to make mental wellness fun. You can find the leave a review button, as well as all the YouTube visuals, bonuses, and ways we can help to support you on our website, podcast.grooveforhealth.com. I appreciate you more than words can say. See you next time, and remember, together we have everything we need.